Um, okay, so we're about 3 sessions from the end, I think, of this amazing travelogue that we've had through this field. So this session is devoted to trajectories, health, safety, and well-being of young adults involved in the justice system. I am the moderator, but I have a substantive interest in this, so I'll probably say, I'm going to say something now, but maybe say something later too, time permitting. So this is later. That's not now. Okay. All right. So one of the challenges I think that we've had in thinking about the workshop, and then if funding becomes available for a consensus study, we'll certainly have to grapple with it there, is some of the uncertain questions of scope relating to young adult. So, you know, we've kind of fudged it by saying, well, we generally speaking are thinking between 18 and 28. But for most purposes, for purposes of the workshop, it really hasn't mattered. I mean, people have had to deal with the data that they've had, you know, and we all have a common sort of basic conception of what we're talking about. But sometimes, maybe for, you know, purposes of consistency in reporting data and so on, it's useful to think about both conceptually and empirically what ages you're talking about. And obviously it has great social relevance here. And I will have more to say about that later. So we've been able, I think, to avoid really focusing on that question much. But in the system in the justice system, it's almost inescapable. You're going to stumble over, you know, this question because of jurisdictional ages about the juvenile justice system, the adult justice system. The other issue is well-being, so health, safety, and well-being. And I think generally speaking, in the course of the 2 days, we've been able to kind of, you know, not worry too much about defining, you know, what that meant. In the last session, Gina Samuels mentioned that as an important, you know, issue. Practically speaking, in terms of, you know, mission and so on. And I think even there, despite the, you know, I mean, one has to sort of come to terms with what one means by that in terms of thinking about an official function. But with regard to children and families, it's, you know, I mean, I think we have a conception about why that's important, you know, that we're not only talking about health and safety, but there are all these precursor conditions and for, you know, successful development. I think when we get to young adults, it's a challenge. And, you know, because obviously writ large, it certainly reaches into all the aspects of having a successful life course. And particularly as we've seen, I mean, just to pick a really important example, you know, education and employment and the development of human capital and so on is a critically, you know, important aspect of everything that we're talking about here. But surely a study that at least a centerpiece is health and safety, you know, can't sort of reach entirely into successful life course for young adults. So it's an issue our committee has, you know, thought about and will eventually, you know, as I said, we'll have to grapple with it, you know, a little bit more specifically. But again, I mention it now because not only because I have the mic, but also because it is really important for how to think about what we're trying to learn about the justice system involved youth. Because the macro issue, of course, is the impact of justice system involvement on successful life course and on employment and, you know, the many, many things about the transitions to successful adult roles and family. You know, so the whole transitional aspect of young adults and what involvement in the criminal justice system, particularly incarceration, does for that is a huge issue. And of course, even from the standpoint of criminal justice policy or juvenile justice policy, it implicates really one of the fundamental issues of social policy here, which is the rehabilitative ideal, you know, of the, you know, the juvenile justice system, certainly, in terms of its aspirations and the uncertainties that we've had about how committed we are to that. And then even with regard to adults, where we basically abandoned you know, the rehabilitative ambition, you know, of justice system involvement. And it's a critical issue in all the current debate about over-incarceration and what we are to do about that. So, I mean, those are huge issues, and I understand my panelists are going to allude to, you know, those issues, but, you know, you can just understand that those are huge. And then the other thing that we wanted to focus on that was really, you know, at the heart of what we're trying to do in this workshop is the health consequences of involvement in the system, in the juvenile justice system or the adult criminal justice system, and particularly the effects of incarceration, and maybe the opportunities that justice system involvement, you know, might provide for more successful health promotion activities or prevention. So that's the micro issue that we certainly want to focus on. But as I said, the other is almost inescapable. Okay, so what I will do, I think I will just introduce both of our panelists now, and then, you know, when one is done, the other will continue. So Ed Mulvey from the University of Pittsburgh will talk about trajectories of young adults coping with the problems of data, and he's done some studies that at least help us think about the trajectories of people through the systems. And then Robert Greiffinger from the John Jay College of Criminal Justice will talk about the health and safety of justice-involved people, thinking about both the macro and the micro issues. Ed, it's all yours.